Interior drawer test for ACL. Test item cluster for cervical radiculopathy. Upper limb tension test. A. Head towards me. Does that make your pain worse?
No.
Away.
Yes.
Can I have you sit up for me? Look to your left. Cervical rotation less than 60 degrees. And go ahead and bend your head to the left. Here. Sperling's test. Does that increase your pain?
No.
Does that increase your pain?
No.
Distraction test. Does that decrease your pain?
Yes.
Differential diagnosis between a C5, C6 radiculopathy and rotator cuff tear. Decreased reflexes will be apparent in the radiculopathy in like the biceps, for instance, and C6 for the brachioradialis. Good. Also, there will be myotomal weakness in the radiculopathy, such as in both the C5 myotome, hold here, don't let me move you, as well as the bicep for the C6. Don't move you, good. Also, there will be decreased sensation in the radiculopathy along the C5 and C6 dermatome patterns. According to Maitland, strip runs down the arm, and C6 on the outer lateralmost section. You can choose sharp, dull, soft touch sensation. Also, a rotator cuff tear, the pain would be primarily during movement or active use of the muscle, such as during the manual muscle test, whereas the radiculopathy would only be constant all the time, shooting pain down the arm. Also, the radiculopathy would be positive for a test item cluster, which includes a Sperling test. How do you rotate your head for me? Distraction test, as well as, you lay down for me? Upper limb tension test, A. Rotate your head towards me and away from you. Good. And can you look to your right, as well as less than 60 degrees ipsilateral rotation in one direction. And rotate to the left. Good. Vapor test. Does this replicate your pain? Okay. Depression test. Does this replicate your pain?
No.
Distraction test. Does this replicate your pain?
No.
Okay. Posterior drawer test. And Fungus and Varus.
Okay.
Ottawa ankle rules. Tenderness in the posterior distal 6 centimeters of the fibula. Tenderness at the posterior distal 6 centimeters of the tibia. Tenderness at the navicular. Tenderness at the base of the 5th metatarsal. Can I have you stand up for me? Inability to weight bear more than 4 steps in the clinic or in the emergency room. Thusly test for meniscal tear. Test item cluster for thoracic manipulation. Cervical extension less than 30 degrees. Looking up doesn't aggravate your symptoms.
No.
Diminished T-spine kyphosis. FABQ score less than 12 and no symptoms distal to the shoulder. Symptoms less than 30 days. Test item cluster for spinal manipulation. Have your symptoms been 16 days or less in your lower back pain?
Yes.
Do you have any symptoms distal to your knee?
No.
Do you have an FABQ score of 18 or less on the work subscale?
No.
Okay. And do you have any hypomobile segments here?
Oh, there it is. That was it.
Okay. Can I have you flip over for me? Internal rotation, greater than or equal to 35 degrees. The hip. Nope. Test item cluster for spinal stabilization. Straight leg raise, greater than 91 degrees. Okay, gotcha. Average of both sides. Yes. Sir, are you under 40 years of age?
Of course.
Alright, can you sit on the edge of the bed for me?
Sure. Oh.
Aberrant movement. Present. Painful arc of motion. Can you stand up for me?
Oh. Oh.
Alright, and come over here. What I want you to do is lay your torso on the bed, hold on to this table, okay?
Okay. Oh.
Alright, is this your pain?
Oh, that's painful.
Yes. Can you lift your legs up for me and hold it there?
Oh, that's not painful.
Okay. And that is the test item cluster. Upper limb tension test, A. Tilt your head towards me. Does that make the pain go away?
Yes.
Away from me?
Oh, it's worse.
Yeah. Test item cluster for subacromial impingement. Alright, can I have you hold your arm out front here? Okay, relax. Does this replicate your pain?
Yeah, it hurts, yeah.
Okay. Next, can I have you raise your arms up at a slight 30-degree angle? Bring them all the way up for me. There. Good. Is there any pain in there?
Oh, no.
Okay. And lastly, can I have you hold your arm out like this? Here. Don't let it move in.
Right.
Yep. No pain, no weakness. Okay. Cluster for rotator cuff tear. Alright, can I have you bring your arms up just like you did before? 30-degree angle, straight up. Is there any pain with it?
No pain.
Okay, go ahead and lower your arms back down slowly. Alright, and no arm drop, so it's right here, don't let me move it.
No pain there.